Hi, folks. I'm Dan Dworkis. I'm an emergency doctor, and I am the founder of the Emergency Mind Project, which brings together lessons from the emergency department and beyond about performance when it matters the most and applying knowledge under pressure. In this video, we're going to be talking through some of my favorite techniques to mentally prepare for a code blue or cardiac arrest situation. Now, obviously, I'm an emergency doctor, but what we're going to talk about here is valid for you no matter what your role is as part of the team. So, whether you're a student, a nurse, a pharmacist, a respiratory technician, a paramedic, or anyone else in the room, these are things that you can start doing right away to improve your ability to deliver care in these highly dynamic and incredibly impactful situations. Now, if you like what you hear and you want to learn more about what we do with the Emergency Mind, you can consider signing up for our podcast, which you can find at our website, emergencymind.com. You can also hear more about our book, The Emergency Mind, Wiring Your Brain for Performance Under Pressure. You can find that at Amazon, or you can learn more by going to emergencymind.com/book. Okay, all that said, let's jump in. I hope you enjoy. In this talk, we're going to be looking at 3 different techniques that we can use to prepare ourselves mentally for code blue situations. We're going to talk about left shifting our curve, splitting problems that are large into smaller ones, and finding our locus of control. Now, the underlying idea behind all of this is that often as we approach a really critical situation, we feel this internal gap between where we are and where we need to be. There's a difference between how we're able to perform and how we really want to be able to perform, both as individuals and teams. Now, to cross this gap, we really need 2 things. We need the medical knowledge, and we need the ability to apply that medical knowledge under the pressure of the situation. In this talk, we're not going to be speaking about the medical knowledge, but we're going to be talking about different ways that we can apply knowledge under pressure. The great part about this is when you bring these 2 things together, when you have a deep base of medical knowledge and you're able to apply it under pressure, boom, that's when magic happens. First thing we're going to be talking about is left shifting our curve. And the curve we're talking about here is this, which is called the Yerkes-Dodson curve. And it's an experimental relationship between how individuals perform under pressure and the level of arousal or stimulation that we feel while we're on there. Now, there's some details to this that we're going to gloss over. It doesn't apply to everything, but it's a great and very useful model for understanding at a basic level how we perform under pressure. So what this says is that when we are understimulated, when we're bored, we tend to perform really low, and you can see that on the left side of the curve. Also, when we're overstimulated, when we're frazzled, then we tend to perform fairly weakly because, again, we're overloaded by what's happening. And that all of us have this sort of optimal peak of arousal where we're just stimulated enough to really be in our zone, but we're not so overloaded that we're completely frazzled. Now, the particular shape of this curve might be unique to you or might be unique to your team, but whatever it is, most of us obey this sort of a bell-shaped relationship between performance and arousal. So when we talk about left shifting our curve, what we're talking about is going from a state of high, overwhelming frazzle back towards a more useful zone where we're stimulated enough and we can really perform at our best. So how do we do that? And the chances are that as we walk into a code blue situation, we're going to be really overloaded. We're going to be really frazzled. And potentially that's mentally because we're thinking about the impact of the situation. We're thinking about how severe it is for the person. Maybe we know the patient, maybe we don't. Maybe it's physical frazzle because we're sprinting to a location where somebody needs us, or we're carrying heavy gear with us or something like that. But whatever the case may be, we're overwhelmed and we need to left shift our curve. So to do that, we want to think about it in really 2 parts. Left shifting has the awareness and the actual left shift part. So let's break that down a little further. So awareness is essentially asking, where am I on my curve? And it's an internal sensor that basically lets us look inside and say, how am I doing right now? How do I know where I am on this curve in the moment? And how does it look in my team? And these are fairly personal questions, right? Because being frazzled and overloaded feels and looks different for individuals. You might experience it as sweaty palms, or as a little bit of a tremor, as an agitation in your voice. Maybe you feel it as a pain in your stomach or something like that. But whatever it is, it's up to you to sort of understand internally how overloaded you are at a particular moment. And also, if you're part of a team, to recognize that in the members of the team that you work with. So how does it look for them and how does it look for you? Now, once you've identified the fact that you are too far to the right of the curve, this comes the second part, which is actually left shifting your curve. So how do you move yourself back over? And again, these are a really personal set of questions. And so it helps to ask yourself what actually calms you down and what helps you focus. And out of those things, you can ask, well, what can I prepare ahead of time and use when I need it? So how do you left shift is really the question. And again, it's something you need to figure out for yourself. Some people use breathing patterns, they use a mantra or a particular phrase that they prepare ahead of time, or they even use a physical stance or a movement. Personally, I often take my own pulse with my left hand feeling the pulse on my right wrist. That's something I've trained over time to allow me to understand how to left shift myself in that curve. Other people use certain patterns of breathing. A popular one is what's called a physiologic sigh, which is 2 inhales followed by an exhale, something that sounds sort of like this. And there's some evidence that allows you to really slow down your heart rate a little bit and bring yourself from the right side of the curve from frazzle more towards the middle into the calm area where you can do your best. Now, regardless of the technique you pick, the idea here is that understanding the Yerkes-Dodson curve allows you to recognize when you're overloaded, which is likely going to be at the beginning of the code blue scenario, and deploy a technique that you've prepared ahead of time to move yourself into an area of more optimal performance. Well, how do you practice that? What you want to do is practice it in low stress times. So if you're going to be part of a Code Blue team, ideally you want to do some simulation around Code Blue events. And in those simulations, concentrate not only on the medical knowledge about what care you're supposed to deliver, but on the application of that knowledge, how you deliver that care. So when you're doing a sim, you want to try deploying these left shifting techniques and seeing if you can really bring yourself more into that optimal zone. Now, maybe that's too much. Maybe you're too focused on the medical knowledge and it feels too overwhelming, or you don't have access to a sim lab. No worries. You can also practice this in extremely low stress times. Things like, oh, I just spilled some coffee on myself, or, oh, I just stumbled over what I'm saying, or I just tripped. No problem. Whatever the scenario is, and you find yourself a little bit too frazzled, try practicing that technique to bring yourself back to the middle. This is also a great way to experiment among a variety of techniques. You want to try different things on for size and see what works for you to left shift your Yerkes-Dodson curve, because you want to have that ready to go when you actually find yourself in that Code Blue scenario. Okay, so the second thing we're going to be talking about is the idea of splitting large problems into small ones. Now, when we think about this idea that we talked about earlier, this idea of crossing the gap, this often feels like an incredibly difficult chasm, like there's this huge distance between where we are and where we need to be. In the setting of a code, often we feel that distance most between where we are, which is a coding patient, and where we want to be, which is ROSC. Now, it can be totally overwhelming to sit there and try to think about how am I going to get all the way across that gap in one step. But the idea of this part about splitting large problems into small ones is to do what's called the island approach. And what this allows us to see is that it's really not one giant gap. Instead, it's actually a group of individual islands that we can step across. We don't have to get from island 1 to island 10 all at once. We can go step by step. We can break a large problem into a smaller problem. All right, so what does this really look like? Well, what are the islands that you can use during a Code Blue? And there's a couple ways to think about this. One is what is predictable within the unpredictability of a code. Now, that's worth pausing and thinking about again for a second. So codes are inherently unpredictable environments, but even within these incredibly fast-moving, unpredictable environments, there's probably subparts that we're going to encounter again and again. These are things like getting the pads on the patient, getting the first round of ACLS done. These are circumstances that we're going to keep seeing no matter what else is going on in the code. So that's an island that you can start thinking about. What is predictable within the unpredictability of a code? A more concrete way to think about this is, what do I already know how to do well? What individual skills will I be required to do in a code that I'm very comfortable doing? And those things that I do well can serve me as an anchor or an island as I'm trying to move across from a coding patient all the way to the other end to somebody that has ROSC. So let's take some examples. So what are things that we're likely to see in the middle of an unpredictable event? Well, maybe we'll see the first cycle of ACLS. In fact, we will always see the first cycle of ACLS if we're running an ACLS algorithm for a code. We'll often want to secure the airway. And for each of these islands, we can think about what are the steps involved in it. So what do we need to accomplish during the first cycle of ACLS? If we're securing the airway, what are the steps that the rest of the team will be taking? What are the steps that I'll need to take? And we can really define those and get pretty granular within them. And the more we're able to conceive of what these islands are like, what these moments in time are like, the better they'll be able to serve us as a stepping stone as we get all the way from A to B. Alternately, from a more skills-based approach, we can think about individual skills we might need to do. Maybe we're in charge of placing an IV in the middle of a code. Okay, well, we can think about how to place that IV and place it really well. Maybe we're in charge of delivering code medications. All right, again, we don't have to do everything. We just have to do this one small piece, and we have to do it really well. So our challenge then is twofold. So first, we need to identify the islands we'll likely use during a code. And again, here are some examples, transitioning from BLS to ACLS, the first round of ACLS, the moments around securing an airway. And for each of these islands that we identify, we want to really think about which ones we know how to do really well and which ones need more work. So I would encourage you, as you're listening to this, to break down your particular role within a Code Blue environment and think about what islands you're likely to encounter. And then ask yourself, which of these am I good at and which of these do I need more work on? Again, as you do this, you're already breaking down a large problem, getting from a coding patient all the way to ROSC, into a much more manageable set of small skills. Now, this also interfaces really well with the part one we just talked about of left shifting your Yerkes-Dodson curve. Because when we try to go from A all the way to Z in one movement, that's really overwhelming and can easily lead to frazzle. Taking small steps from A to B, from B to C, and etc. are a lot more easy for us to understand, and in and of itself, that helps us left shift our Yerkes-Dodson curve. Okay, so we've identified islands. We want to get to work at more of them and practicing them. How do we do it? Well, the answer is the same as before, which is that we want to practice in low-stress environments. If we're able to have access to a sim lab or a lo-fi simulation in our own unit, where we're able to really train in this exact environment, then we can start breaking down Code Blue scenarios and find these islands and practice them. If we don't have access to that, or if that feels too big or overwhelming, again, we're going to practice in really low stress environments. So anytime we need to do a particular thing, say like parallel parking, which is maybe scary the first couple times we do it, and it's an A to Z scenario, we're going to break that down and say, well, what are the steps? What are the islands that I need to really accomplish? Okay, well, I need to position my car. I need to start reversing. Then I need to decide when to transition between reverse and drive. And all of these things I can break into small skills and practice. Okay, the third thing we're going to talk about is the idea of finding and acting within our locus of control. Now, as we go into a Code Blue scenario, there's going to be, again, a lot of things going on. There's things that we are a part of. There's things that other members of our team are doing. There's things that are inherent to the patient or the environment. And it's going to be tempting initially at the beginning to want to control everything, to want to exert as much control over the universe as possible. But the thing is, it doesn't really work that way. And in fact, we can sort of divide things that happen in a Code Blue scenario into what's in our control and what's outside of our control. And by focusing entirely on where we have the power to change things, by focusing entirely inside our locus of control, we're really able to make the best difference and to deliver the best possible care to this patient. So a good way to think this through is through the idea of an archer. Now, as you look at this, right, we see an archer who's about to loose an arrow at this target. And what we see is that there's some things that are in the archer's control and some things that are outside the archer's control. So what's inside the archer's control? Well, first off, all of the training she did up until the point where she's about to shoot this arrow, how she's standing, the tension she's drawing on the bow, the way she's aiming, the thoughts that she's thinking, everything that's internal to her. What's outside of her control? Everything that happens after the arrow leaves her bow. So what flight path the arrow takes, the influence of weather and outside events, whether a bird swoops down and grabs the arrow, which is obviously extraordinarily unlikely but could happen. And ultimately, of course, whether the arrow actually hits the target or not is outside of her control. And that's really difficult to accept for all of us, right? We all want to hit the targets we aim at. But ultimately, what we actually control is inside of us, not what happens outside after the arrow leaves the bow. So at least as we think about the mental skills for performance during a Code Blue event, a better version of this picture looks like this, where all of the focus is on us internally, not on what happens after we deliver our skill. In a more medical example of this outside of archery, this is a picture of a floor after a cardiac arrest I was part of. And what we can remember here is that while we don't ultimately control what happens to the patients we care for, we are not omnipotent and not all-powerful. What we can control, what we can work on is our own performance. So this little doohickey here reminds us to deliver excellent, high-quality chest compressions, right? And that's a thing we can always do. We can train on better chest compressions no matter what our role is in a Code Blue team. So a reminder of this actually comes from the Stoic philosopher and Roman Emperor Marcus Aurelius, who said that you have the power over your mind, not outside events. Realize this and you will find strength. So our question becomes, in the middle of a code, what can we do right now to make this situation better? What's within our locus of control? Where do we have the power to act, to perform better, to deliver better medical knowledge, and to help our team improve? So as we ask this in different stages of a Code Blue event, it can help us identify priorities for where to work and where to improve. If we ask this, for example, in the 1 or 2 minutes before a patient arrives into an emergency department, we might say, okay, what can I do to make this situation better? Well, maybe I can set up the room more efficiently and make sure there's oxygen under the bed, double check the suction. In the middle of a code, as we're getting ready for a pulse check, maybe I can think, okay, what can I do to make this situation better? Well, pretty likely we're going to want to deliver calcium at this next pulse check. Let me make sure that's right at the bedside, ready to go. The more reps you do this, the more you focus on what's inside your control, the better and more creative you'll be at finding these solutions. Incidentally, this also interfaces back with the first 2 techniques we built. So the more focused we are in our own locus of control, the easier it is to left shift our Yerkes-Dodson curve because we're not playing with things that we have no ability to interact with. Also, as we break large problems down into small problems, we'll often find that the small problems have more to do with our locus of control, and the large problems have more to do with things that are, well, partly in our control, often also involving things that aren't in our control. All right, so how do you practice this? Well, at the risk of sounding like a broken record here, you practice this in lower stress environments. Okay, if you're in the middle of doing sim, you want to identify where you have the ability to make this sim case go better. If you're in an extremely or really low stress environment, again, you want to think to yourself, where do I have the ability to make this situation better? And how do I make sure I'm acting there? All right, let's wrap this all up. What we talked about in this brief video is 3 techniques that anybody, regardless of your role on a Code Blue team, can work on to improve their ability to deliver knowledge under pressure. We talked about left shifting our Yerkes-Dodson curve, understanding our relationship to stress, and building techniques that allow us to improve our relationship with it and therefore our performance. We talked about splitting large problems into smaller ones, taking the island approach. Instead of trying to get all the way from A to Z, recognizing that what we really need to do is go from A to B and then B to C very well. And then ultimately finding our locus of control, identifying what we have the ability to interact with and what we don't, and focusing our energy where we can make the most difference. All right, I hope you enjoyed that. I think that understanding the mental skills that we do for Code Blues and Code Blue training is an incredibly important part of what we do with the emergency mind. I hope that you have got something out of this that you can do differently and that you can prepare yourself for before your next Code Blue. And I hope that you enjoy. If you have any questions about this or any further ideas, I'd love to hear from you. You can reach me at dan@emergencymind.com.